Good evening. Overall, cases of bowel cancer in Scotland have fallen in recent years, thanks in part to a nationwide screening programme for those aged between 50 and 74. But alarmingly, at the same time, there's been a rise in cases among those under 50. The reasons for that aren't known. Selena Jackson has been hearing from someone in their 30s who received a shock diagnosis and speaking to medics who are seeking to improve the outlook for everyone.
People think your worldview gets bigger maybe when you're faced with that kind of thing, but actually you just care about your family, friends, just small things.
Catherine Duncan's life looks much like that of any other woman in her 30s. She spends her days juggling her busy job as a retail manager, socialising with friends and making the time to keep fit. But 3 years ago, she was faced with news that turned her life upside down.
Obviously, you never expect it to happen to you. You think, oh gosh, it just couldn't be. So obviously it was a huge shock.
At the age of 36, she was diagnosed with bowel cancer. Catherine had been noticing some symptoms, but her GP disregarded the possibility of her having cancer.
I knew something wasn't right. It'd been going on for a long time, and it was getting to the point that it was just, unmanageable. So having to keep pushing the doctors, they thought it could be IBS. Allergic to something I was eating, piles, anything like that. Irritation just of the gut, not really being sure what was causing it, but just some kind of inflammation and irritation.
Symptoms of bowel cancer include, but aren't limited to, a change in toilet habits, pain in the stomach, noticing blood in the toilet, and unexplained weight loss. How much of a factor do you think your age played in the fact that the doctors were initially dismissing the chance that it could have been bowel cancer?
I would say that's 100%.
Catherine kept pushing for further tests and, after 7 months, was finally sent for a colonoscopy.
It's a camera that sees the tumour there, so they're obviously looking at the source of the problem when I had the colonoscopy. So they were not able to give a prognosis or a stage until I had a scan done. Could have been early stage and they can just cut it out and no further treatment required, or it could be stage 4, or you just don't know. After the scan's done, you have to wait a few days to get the results. That's probably the scariest moment, is trying to phone the doctor.
It's a really horrible period. It's okay, take your time. The number of under 50s being diagnosed with bowel cancer is on the rise. Between 2013 and 2023, there was a 49% increase in Scotland, rising from 6 to 9 per 100,000 people. Often, the disease is found at a more advanced stage. And the problem isn't unique to Scotland or the UK. It appears to be replicated across the globe. Dr. Santi Susanti is a cancer researcher from Indonesia based at the Cancer Research Scotland Institute. She's looking into how genetics can increase the chance of developing early onset bowel cancer.
In my home country, we have about 30% of early onset colorectal cancer among all those colorectal cancer patients, while in the West, for instance, UK is counted for 10%, but it's rising. So it's a global phenomena that we see at the moment.
She's been working in the area for over a decade, but has a unique perspective.
I already studying cancer. I supposed to go back to Australia to do my PhD, and I took a break back in Indonesia where I came from, and during that time I was diagnosed with colorectal cancer myself. I was under 30 years old at that time. Obviously, being a cancer researcher and then suddenly diagnosed with the cancer myself is huge experience and also emotional roller coaster.
Dr. Susanti underwent surgery and chemotherapy and was left with a stoma. She says her experience has only made her more determined to improve outcomes for people like her. It was understandably such a shock for you to get diagnosed at such a young age, but do you feel like it's really given you a drive to help other people that have unfortunately found themselves in your position?
Yeah, it makes me love doing research more, and I feel that I have mission in doing what I'm doing at the moment. But on top of that, it's also sharing the optimism to another cancer patient or cancer survivor. It's never easy because once you got diagnosed, even though you are in remission, or like me in remission, it's always there in back of your head that, oh, could it come back? It basically already impacted yourself. Because of that, I think whatever that we can do to make the treatment or the experience better, it will be helpful. And that's how I want to spend my life and my time.
Dr. Susanti is part of a team of researchers in Glasgow working to better understand what puts certain people at higher risk of bowel cancer and how to develop more effective treatments.
Yeah, Darf.
Hello.
We're looking at the organoids.
Yes.
So there's a concerning rise in the early onset bowel cancers, and we're trying to investigate what's happening. And there's several research groups across the globe that are looking into this phenomenon. At the moment, we don't really know what's going on, and a lot of research is needed. The good thing is that whereas the incidence is rising in the under 50s, the number is still quite low, right? So up to 5 to 10% maybe of the bowel cancers cases that are presenting in the clinic, they will be in the under 50s, which is still a low number. But we need to understand why.
Dr. Johan Vande is examining how bacteria in the gut can impact the effectiveness of chemotherapy drugs.
We would like to design new therapies that are potentially harnessing the microbiome, but also therapies where we can change the microbiome to make the therapies more efficient and be able to achieve therapeutic efficiency with a lower dose of chemotherapy. Because as you'll be aware, chemotherapy has a lot of adverse side effects that we want to mitigate for the patient to make it a kinder treatment. And so we're very much hoping that we can leverage that knowledge to improve the therapies.
While that research progresses, Dr. Vande says lifestyle choices can help to reduce the risk of developing bowel cancer in the first place.
It's about maintaining a healthy lifestyle, it's about being active, and obviously having a healthy diet to prevent obesity, which can be linked to bowel cancer as well. And then cutting out smoking, as well as reducing your alcohol intake. And the great thing about bowel cancer in a way is that around 50%, so half of the cases, are preventable. And those are really important risk factors that we can influence. And we know that also in bowel cancer there is an imbalance in the gut microbiome of patients. At the moment, we're still trying to understand what exactly is going on and whether this is actually linked to the onset or to the progression of the disease. But maintaining a healthy lifestyle and making sure that microbiome stays in balance is a good thing to do. And for example, having a fiber-rich diet is ensuring that the good bacteria are having an opportunity to thrive and to grow out with as little room as possible for the pathogenic bacteria, as we like to call them, the bad bacteria that are obviously going to over-colonize and could have effects on the intestine.
Catherine thankfully avoided the need for harsh chemotherapy. After an operation to remove the tumour and part of her intestine, she got the news that the cancer hadn't spread.
How are you doing now? You're such a great example of what can happen when it is caught early and show that you can make a full recovery.
Yeah, just back to life, just enjoying myself, fully recovered from the surgery. Don't really have any after side effects or after effects, so just living normally as best I can. I mean, obviously your life has changed and you maybe see the world a little bit differently, but you can go back to living your life normally, for sure.
You must be so passionate now about trying to prevent this from happening to other young people. Do you think that there's anything that could or should be done to take young people's concerns more seriously when they do come to the doctor?
That's exactly it, just to make sure that they're doing the testing as soon as they can, rather than cancer being the last thing that they're looking for, rather make that the first thing that they're looking for, and so that the concerns are taken seriously. And it's just not a disease that's just over 50. You have to advocate for your own health. You know if something's not right with your body, so you have to keep going back to the doctor and don't let them dismiss you. Just keep phoning and going back and back until the problem is solved and you get a conclusion of what's wrong.
And if you've been affected